If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
I had that dream again. My small business needs to hire, but I don't use LinkedIn, and I hire an energy vampire. But also they're a literal vampire. And suddenly my team is spending all their time sharpening wooden stakes and buying bulk silver and rehearsing ancient chants, and then I wake up.
Don't let hiring nightmares ruin your dreams. LinkedIn Jobs' new AI assistant takes insights from over 1 billion professionals to create a short list of the best fits for you. Post your job for free at linkedin.com/quality. Start hiring today with LinkedIn.
Walmart Business is in the business of helping your business. Regardless of whether you're building bridges, building spreadsheets, or building lesson plans. Ooh, that looks fun. Walmart Business can help save you time, money, and hassle so you can focus on what you're building instead of what your supply closet is missing. In short, we take care of business so you can do more with yours. We're the Walmart you love, now for your business. Learn more at business.walmart.com.
Hi, I'm Dr. Raj, and welcome to the Med Prep to Go podcast. Today, I will be reviewing 3 questions from anatomy. If you want to learn more about me, you can find me on many social media platforms, and please check out my book series for USMLE Step 1, The Basic Sciences. The series is called Case Report, Beyond the Pearls, and for USMLE Step 2 and 3 type questions, the clinical aspects, please check out my morning report, Beyond the Pearls. And we have OB and surgery and psychiatry and, of course, internal medicine. There's an anesthesia book, and I could go on, but let's get to the questions today. So, first question is, a 65-year-old woman presents to the physician's office with a painless mass on the right side of her face that she noticed 2 weeks ago. Past medical history is significant for hypertension and osteoporosis. Physical exam reveals a palpable mass in the right parotid gland. Cranial nerves are intact and no lymphadenopathy is noted. An MRI reveals a likely malignant tumor, and she is referred to a head and neck surgeon for further evaluation. Question: which of the following nerves is most at risk for injury during this parotidectomy? A, facial nerve, B, optic nerve, C, trigeminal nerve V2, D, trigeminal nerve V3, E, trochlear nerve. Sorry about that, everyone. What do you think is going to be the answer? The correct answer is A, the facial nerve. The facial nerve courses between the superficial and deep layers of the parotid gland and then branches into its 5 major sensory nerve fibers: the temporal, zygomatic, buccal, mandibular, and cervical at the anterior border of the parotid gland. Answer choice B, the optic nerve, is incorrect. The optic nerve leaves the bony orbit via the optic canal, where it unites with the optic nerves from each eye to form the optic chiasm. At the chiasm, fibers from the medial half of each retina crosses over the contralateral optic tract, while fibers from the lateral halves remain ipsilateral. Each optic tract travels to its corresponding cerebral hemisphere to reach the lateral geniculate nucleus. Axons then carry visual information via the optic radiation to the visual cortex. Answer choice C, trigeminal nerve V2, is incorrect. Trigeminal nerve V2, the maxillary division, exits the cranium via the foramen rotundum and gives rise to 14 terminal branches which innervate the lower eyelid and its conjunctiva, the cheeks and maxillary sinuses, the nasal cavity, and lateral nose, the upper lip, the upper molar, incisor, and canine teeth, and the associated gingiva and the superior palate. It provides parasympathetic supply to the lacrimal glands and the nasal glands. Answer choice D. Trigeminal nerve B3 is incorrect. Trigeminal nerve B3 mandibular division exits the cranium via the foramen ovale and provides sensory supply to the mucous membranes and the floor of the oral cavity. External ear, lower lip, chin, anterior 2/3 of the tongue, and the lower molar, incisor, and canine teeth, and the associated gingiva. It provides motor supply to the muscles of mastication, anterior belly of the digastric muscle, and the mylohyoid muscle, the tensor tympani, and the tensor veli palatini. It also provides parasympathetic supply to the parotid gland and the submandibular and sublingual glands. Answer choice E, trochlear nerve is incorrect. The trochlear nerve moves along the lateral wall of the cavernous sinus before entering the orbit of the eye via the superior orbital fissure. So what is the learning point? The facial nerve courses between the superficial and deep layers of the parotid gland before branching into its 5 major sensory nerve fibers at the anterior border of the parotid gland. This puts the facial nerve at risk for injury during surgery on the parotid gland. Next question. We have a 50-year-old woman presents to the clinic with rectal discomfort and bleeding for the last 2 months. Past medical history is significant for hypothyroidism and hyperlipidemia. She has 4 children that were delivered vaginally. Vital signs are within normal range. A physical examination reveals evidence of an external hemorrhoid. Which of the following is the correct order of venous drainage of this lesion? Is it going to be A, internal pudendal vein, the obturator vein, the internal iliac vein, and the common iliac vein? Is it B, the internal pudendal vein, the inferior mesenteric vein, superior mesenteric vein, common iliac vein? Is it C, inferior rectal vein, inferior mesenteric vein, common iliac vein, inferior vena cava? D, inferior rectal vein, internal pudendal vein, internal iliac vein, and common iliac vein? Or E, superior rectal vein, internal pudendal vein, common iliac vein, inferior vena cava? The correct answer is D as in dog. That is the combination of the inferior rectal vein, internal pudendal vein, internal iliac vein, and the common iliac vein. So an external hemorrhoid is ectoderm in origin and can be a source of pain and discomfort due to its nerve innervation by a branch of the pudendal nerve. It is drained by the venous system in the order of the following: inferior rectal vein, internal pudendal vein, internal iliac vein, common iliac vein, and lastly, the inferior vena cava. Choice A was internal pudendal vein, obturator vein, internal iliac vein, common iliac vein is incorrect. The obturator vein does not drain the internal pudendal vein. Answer choice B, the internal pudendal vein, inferior mesenteric vein, superior mesenteric vein, common iliac vein is incorrect. The inferior mesenteric vein is not drained by the superior mesenteric vein and does not drain the internal pudendal vein. Choice C, the inferior rectal vein, inferior mesenteric vein, common iliac vein, inferior vena cava is incorrect. The inferior mesenteric vein does not drain the inferior rectal vein. Answer choice E, which is superior rectal vein, internal pudendal vein, common iliac vein, inferior vena cava is incorrect. The internal pudendal vein does not drain the superior rectal vein. Key learning point for this question is External hemorrhoids occur distal to the dentate line and are innervated by branches of the pudendal nerve, which can result in pain and discomfort if a venous plexus is thrombosed. The rectal venous plexus draining an external hemorrhoid drains in the order of the inferior rectal vein, internal pudendal vein, internal iliac vein, common iliac vein, and lastly, the inferior vena cava. Typical complaints of an external hemorrhoid include pain, swelling, pruritus, burning, and rectal bleeding. Depending on the severity and signs and symptoms, treatment ranges from dietary and behavioral changes all the way to surgery.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, Fidelity. How can I remember to invest every month?
With the Fidelity app, you can choose a schedule and set up recurring investments in stocks and ETFs.
Oh, that sounds easier than I thought.
You got this.
Yeah, I do. Now, where did I put my keys?
You will find them where you left them.
Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC, member NYSE, SIPC.
All right, let's do our last question. We have a 18-year-old man presents to the emergency department with a stab wound to the abdomen, which he sustained 5 hours ago. The patient was walking home when he was confronted by a thief and stabbed on the street. Well, this is a very violent question. Vital signs are temperature of 98 degrees Fahrenheit. Blood pressure is low at 90/60 millimeters of mercury. Heart rate is tachycardic at 150. I wonder if he's bleeding out. On physical exam, he appears pale and cool and clammy extremities. I think he's bleeding out. Surgical consult is obtained. The patient is taken to the operating room as they should. During a laparotomy, the surgeon finds a stab wound in the middle third of the transverse colon. The bleeding is stopped and bowel anastomosis is performed. So which of the following organs has the same blood supply as the middle third of the transverse colon? Is it A, the first part of the duodenum? Is it B, the gallbladder? C, the greater curvature of the stomach? D, the lesser curvature of the stomach? E, head of the pancreas? And the answer is? That's right. Great job, everyone. It's E, head of the pancreas. The middle third of the transverse colon originates from the embryologic midgut that is supplied by the superior mesenteric artery. The head of the pancreas is supplied by the gastroduodenal artery, a branch of the common hepatic artery, and the inferior pancreatico-duodenal artery, a branch of the superior mesenteric artery. So answer choice A, first part of the duodenum is incorrect. The first part of the duodenum is supplied by the gastroduodenal artery, which comes from the common hepatic artery of the celiac trunk. Answer choice D, gallbladder, is incorrect. Gallbladder is supplied by the cystic artery, which is a branch of the right hepatic artery of the common hepatic artery. Answer choice C, greater curvature of the stomach, is incorrect. This part of the stomach receives its blood supply from the celiac trunk and common hepatic artery. The greater curvature is supplied by anastomoses formed by the union of the right and left gastro-omental arteries, which originate from the gastroduodenal and splenic arteries, respectively. Answer choice D, lesser curvature of the stomach, is incorrect. This part of the stomach receives it from the celiac trunk and common hepatic artery. The lesser curvature is supplied by the union of the left and right gastric arteries, which originate from the common hepatic artery. So what is the key learning point from this case? is that the superior mesenteric artery supplies the midgut structures from the second part of the duodenum until the splenic flexure of the colon. The head of the pancreas is also included. And with this being said, that's going to be our 3 questions for this podcast. I hope you enjoyed them, and good luck in studying for your board exams. And come visit us on our website, medprep2go.com.
Two kinds of phishing out here. One for fish, one for your data. Hackers try to hook you, but Cisco Duo keeps every user and device protected. Cisco Duo. Phishing season is over. Learn more at duo.com.